Dr. Rob Davidson joins me again, and I'm really happy to see you, and I'm happy to see you getting out there. You're doing a ton of media and still 17 other jobs, including family man. Thank you so much for being here and doing this with me.
No, thanks for having me. I'm glad you reached out. It's good to be here.
How are you feeling about the fight? I feel we're talking before I hit record. Your spirits seem low. What do I need to do to pep you up? You're one of our leaders.
No. I'm in the fight, man. I mean, I'm very frustrated with the outcomes of the votes on the budget bill a couple of weeks ago and rescission package, just this past week, and yet the fight goes on. I mean, I think we are the opposition to all this damage that they're doing to so many people has never been stronger, and so now I guess we pivot, right? I'm ready for the electoral politics that are coming in 2026. We got to make these guys pay.
Yeah, absolutely right. Let's get into some of the health care issues and policy issues that you can tell us about, teach us about, and are advocating for on behalf of your patients all over the country, especially in these rural areas. I want to ask you about these Medicaid cuts. Nosferatu Goebbels, Stephen Miller, tweeted that once he gets all the immigrants out, there will be no more waiting times in the ER. You've worked in the ER for years. My understanding is as a result of the Medicaid cuts, there's going to be a whole lot more very American patients coming to the ER because they don't have health insurance anymore. So what's going to happen to the ER as a result of deportations and Medicaid cuts? Who wins?
Yeah, I mean, it's all bullshit. Everything they say is. The reality is when people lose health insurance, and that's what Medicaid is, right? I'm so sick of the tropes of people sitting on their couch playing games, collecting Medicaid. Nobody collects Medicaid. People go to the hospital, they go to their doctor because they're sick or because they have a long-term disease they need to control. And Medicaid is the insurance company that pays for that care. Like, it's plain and simple. And so when you take away that insurance, people with diabetes, people with high blood pressure, people with chronic diseases can't go see their doctor. They can't get their meds. So then they have strokes, they have heart attacks, they have all the complications of these diseases that we know how to prevent. That brings them into the ER more than they would have otherwise. And just like basic things, you have a bad cough for a few weeks, you can't shake it. You've got some bronchitis, you need some meds, and you don't have insurance. You can't just go to a random doctor's office, but thanks to EMTALA, which I'm grateful for, a federal law that says we have to see everybody who comes in and stabilize them, you can go to the ER. It used to be under the Biden administration, they were not counting medical debt against your credit report. They just sued to get rid of that, and a federal judge in Texas just took that away as well. So now, you can go to the ER, thankfully. They'll still get bills that they're not going to be able to pay. Hospitals will have to eat that, but of course they're going to pass it on to consumers. They're going to pass it on to insurance. Who's going to pass it on to people who are insured. And on top of waiting longer for care, your costs are going to go up. Like, it's so easy to draw the straight line. We've been saying it. They know it. The Republicans who were against this bill and said so out loud said all of this. Josh Hawley said it. Tom Tillis said it. 8 Republican members of Congress in sort of purple districts wrote a letter to that effect, and then they all voted for it. Like, it's incredible.
Well, to Josh Hawley's credit, he's now trying to create legislation to get it back. Did you see that?
I mean, he's got a history of sort of flip-flopping, right? He raised his fist on January 6th, and then he's a guy we saw running, right? That kind of weird run.
Listen, we don't.
So,
listen, we won't have he's I have a hollow barrel meter. Like, who's the hollowest suit? Who will do whatever it takes? No, and you got your Ted Cruz's, you got your Josh Hawley. There's so many of them, but of course, the one at the top of my list is Marco Rubio on my hollow barrel meter. But let me ask you about the consequences of these Medicaid cuts again, because my understanding is, I don't know how this is measured in health policy world, but if you don't have health insurance, and you touched on this, Bo, and you're sick, you might not go at all and get sicker, and you might die, or you might just be a cost burden on family members. Like, all this matters as a result of not having health insurance. All these, people, these tough-willed, rural, poor folks, etc. And that's true. I'm not being cynical about it. I come from those parts in upstate New York. They just won't go. And what are the consequences there? And I don't know how you measure that.
Well, you measure it in excess deaths. That's a real number, right? Up to 50-some thousand a year. And Kennedy was on RFK Jr. We might talk about him as well.
Oh, yeah.
Probably have to touch on that.
Yeah,
But
yeah.
he was on with Kudlow on Fox Business, and Kudlow said, they're estimating 51,000 deaths. I think this is ridiculous. Tell us why it's ridiculous, right? Leading the witness. The reality is that's partly how you measure it. Excess deaths, right? Excess morbidity, more diseases. These are already places where the burden of disease is higher, where people are older, more likely to be on Medicare, more likely to be on Medicaid. And then that's why these rural hospitals are going to struggle, because most, or not most, but much more, up to 40% or so of their patients have Medicaid as their insurance. And while it is true Medicaid does not pay that great, right, compared to Medicare, compared to commercial insurers, it pays more than zero. And so even if everybody did come in and paid zero, the hospital can't handle it. The problem is, and I've seen it up close, people without insurance, or even people with high deductible plans, right? The work plans that they've all said, we'll just put people on those because everyone's going to go get a job that has insurance. A fallacy anyhow. But people with those really high deductibles, they delay coming. And I saw a guy who waited 5 days to come in with chest pain until he couldn't walk up the stairs because he couldn't breathe. Well, at that point, he had lost about half of his heart muscle because of an ongoing heart attack. And he could have come in on day one if he could afford it. You're going to see more of that, because people will literally look at their bank account and say, listen, I got to buy food. I got to pay the rent. I got to pay the bills, because they're going to shut off my electricity or take away my house if I don't do that. But if I ignore the chest pain, maybe I'll be okay.
You talked about EMTALA and the emergency rooms take in whoever. Just one question about people who come to the emergency room and who or suspect are undocumented. How much of a volume, I don't know what words to say. We're talking about human beings. And so I don't know what the health words would be, but how much of an impact, how much of a volume, it's different in different emergency rooms all over the country, but how much of a cost are they? Because a lot of them obviously are doing really tough jobs, dangerous jobs, some of the most dangerous in the country, obviously. Right. What do you want to say about undocumented people and ERs and hospitals in general? Yeah, I'm sure there's a lot of myths.
Yeah, I mean, I'm going to go on a record. I think everyone deserves affordable health care. I don't care where you are, who you are, how you speak, where you're from. So that to me doesn't factor in the day to day. But we do have a significant migrant farm worker population. I'm in rural West Michigan. Asparagus is big around us. Blueberries are big. Other crops are big, and at harvest time, a significant influx in different parts of our catchment area, different counties around us have primarily Spanish-speaking individuals. I have no idea their status as far as documentation. I would venture to guess some of them, at least, do not, have documentation to be here. But it is not a massive burden on the system. These are folks that work their asses off. By the way, they're mostly pretty young and they're pretty healthy.
And when you just said everyone deserves healthcare, like, just to be clear, in this case, if we're talking about insurance, what's interesting about the population that you just talked about is that Republicans prevented the Affordable Care Act from allowing those people to buy insurance, which is insane, because do you want an undocumented person to not be able to buy a soda or a car or a shirt or anything else that you sell? Of course you don't.
Well, they made it more difficult for dreamers, right? For people with legal status, for people with temporary protected status. Yeah.
I make it more difficult or illegal to buy health insurance. Yeah. Everybody wins. I don't want them not paying. I want them to be covered, and the health insurance company gets a new patient and everybody gets paid. Why would you make it? It's ridiculous, but it's just super.
It's punitive. Punitive and cruel, right? It's just to be cruel and punitive, and to, in their minds, right, to dissuade people from being here. People who they don't find to be desirable, the Stephen Millers of the world. It's despicable. We don't think that way. I don't. None of the people I work with do. And most of the people I encounter in daily life, whether they voted for Donald Trump or voted for Biden or whomever, or Kamala Harris, they don't think that way either. And so this issue used to be a winner for these folks, and what they're doing with ICE and masked and ripping people off the streets and taking away their healthcare, taking away the ability to seek care. These are another thing driving a wedge, besides, the 2-week-long Epstein saga that is doing that now.
Yeah, for sure. Let me ask you about HHS, about these cuts, about anything you want to say about the latest from RFK and Mehmet Oz and all of the rest. I mean, I've heard two things I definitely want to have you address that there are these panels that suggest best practices for bronchitis for anything that's common. And then there's another panel, of course, that approves vaccines and schedules them, that then gives the schedule to every internist, primary care doctor in the country, and that's how you schedule the vaccines that you give to your patients. Those two panels have been disbanded, corrupted, replaced with Smurfs. What how big are those two stories? How much do they matter? How much do you rely on those agencies for your work as a physician?
They matter a ton. So the first is the U.S. Preventative Services Task Force. I think that's what you're talking about.
Yes, that was what
critically important panel, right? They're the ones who looked at the data and said, listen, people are getting colon cancer younger. We should recommend screening for people 45 and over, not just 50 over. So there's a 5-year window. When they recommend this, insurance companies are required to cover that. Right. So that we're preventing people from having cancer because they look at the data, look at the research, and they make the recommendation. They make recommendations for who gets mammograms, for who gets screened for any number of diseases that can be genetic, that, you know, if your family member had it, you should be getting an MRI, a CAT scan, ultrasound, what have you. Yeah. And we absolutely rely on those folks because as physicians work in your daily life, you can't just comb the data day in, day out, month in, month out, and just know, here's what I do, here's what I don't. You need a trusted source, you know, with a .gov after their website that can tell you this is what we should do. So that group, they just didn't meet, right? He canceled the meeting, the last one they had. So we have no idea what's going on there.
That caused panic. Canceling the meeting caused alarm and panic amongst health policy experts, doctors, and the like.
For sure. And then the other is ACIP, the Council for Recommending Immunizations with the CDC, Advisory Council on Immunization Practices. And yeah, basically what he did with them, he took 17 people, he fired them all, said there were too many conflicts of interest. He installed 8 of his own people, 2 or 3, at least maybe 4 of them are absolute anti-vax nutters. One of those 8 had to resign within a few weeks because he had more conflicts of interest himself than the entire 17 they fired previously. And then they had like this little kind of kabuki theater show about mercury and vaccines that was a non-issue because they got rid of that form of non-toxic mercury, right? Not the kind you get in fish, different type of mercury. Wasn't harmful anyways, but they got rid of it back in the 90s. It hasn't been in single dose flu vax files, but they decided to have a day of hearings and have someone from, RFK Jr.'s old Children's Defense Fund anti-vax front group come and talk about it. And then they made a ruling they were going to get rid of a thing they basically already got rid of. It was for show, right? It was to play to that Maha base to make them think this guy's, doing work on your behalf. And all it does is it makes people confused. It makes folks wheezy. I had a guy argue with me about getting a tetanus booster the other day. And I said, well, I did my own research. Like, oh my God, if I could take one phrase and eliminate it from the lexicon, I did my own research. People should be informed, but going on Facebook and seeing what your crazy uncle or the dude you graduate from high school says about tetanus, that's not doing research.
Doing your own. Yeah. I mean, what are the other answers that you get? I talk to a lot of doctors because I'm kind of a big deal in certain circles talking to doctors.
Oh yeah.
And I always hear that from every physician. I read it from every that phrase. I've done my own research, and it drives me crazy because one of my best friends is a health researcher for a living. So I don't know. I don't know anything about health research. I just know what his job is. If his job is to do health research, it's not my job. So I just ask him, what research did you do today? And then tell me about it. Cause I can't conduct research because I don't know how to, because I didn't study it. It's a thing that you need to learn how to do. What do you say to people, generally speaking, when they're like, I did my own research? Are there thoughtful responses that can keep them open to your research, your expertise that you've been doing your whole life?
So, sometimes, right? I mean, some folks are just really far down that rabbit hole and they're not coming back. But, I ask, what research, where did you get that? Here's where I'm seeing that this is important, right? And I reference the CDC. The scary thing is with RFK Jr. in charge and Dr. Oz over there and others, those data points and those sources of data become more and more challenging to trust as well.
Right.
But you can lean on, and I just tell people, listen, I've been in this community for 23 years. I've probably taken care of some of your family members. I genuinely believe getting tetanus would be a terrible thing. I've never seen it because people get tetanus boosters. And I really feel like this rusty nail you stepped on out in the pasture could be a source of tetanus, like legit. If you cut your finger on a knife in your kitchen, there's probably not tetanus there. Okay, that we can probably not have a real long conversation. You step on a rusty nail in a cow pasture, that is tetanus. That's a hotbed of tetanus.
Longtime listeners of mine will know that I've talked about every minor injury I've had. I just burnt myself on a motorcycle, and I stepped on a number of nails over the past couple of years. I never go and get my tetanus. I just go, I'm fine. And I just keep moving my jaw to make sure it doesn't lock up.
Keep moving your jaw. If it frees up on camera, we'll have to tap and make sure it's not the link, right? And if it isn't, then we'll know we got to call 911.
I would do whatever I'm told by you and any other doctor. So what else do we need to know before I let you go that you're following, that you're talking about? You've launched a new podcast, which I think is great. You've been such an effective advocate, and I'm going to listen to the podcast and promote the podcast and give you advice on the podcast if I've got any of how you can get more and more popular with it, because I think that your voice you're just really effective at this and really smart and thoughtful and compassionate. What else, as we close, are you most concerned about, watching, upset, anger, or afraid of right now?
Yeah, I mean, I think we can get back to the whole mess with what they've done to Medicaid and to the Affordable Care Act, right?
I need to be said.
Because it's an ongoing issue. So the things that worry me is how people move on in the news cycle, right? And even how, when it was in the news cycle, and all of us who were kind of paying attention, and those of us in advocacy who were trying to get the word out in every channel we can come up with, still a significant minority of individuals knew about the Medicaid cuts in the one big abomination. And so I think it's important that advocates continue to apply pressure. We're past the point of trying to get lawmakers to do the right thing. They did the wrong thing. They voted wrong. Josh Hawley's not going to get what he needs passed through the House. They're not going to get him back that Medicaid. And so I think it's keeping up the pressure, because the next thing we can do is in 2026, we can vote the majority of these folks out. It won't completely fix the problem, but they've got ideas of doing more damage. Ron Johnson in Wisconsin has already said we need to do more tax cuts. Don't forget the reason they cut $1 trillion from poor people's healthcare was to give tax cuts to billionaires.
Yeah.
And they want to do more. And the pots of money they can take from that can do that are Medicare, Medicaid, Social Security, or the military. Well, they increased the military spending in the last go around, so they're definitely not going after that. And even they, I think, would be hard pressed to try to go after Social Security. That's still probably a third rail. So it comes down to healthcare, right? That's where they're going to go again. And so I think that's what we're doing, right? We are pivoting into that. I guess the other piece people got to keep an eye on is mifepristone. If people really value the right for women to have bodily autonomy and make their own healthcare decisions, the abortion pill is a way that happens about 2/3 of the time, and they got about 3 or 4 different avenues they're coming after it. So we're gearing up to get in on that fight to make sure we protect people's rights to make their own decisions about their bodies.
Yeah, and stockpile those. I don't know how long they're good for.
I don't know.
I just maybe think of one more thing to ask you, which is, what do you say to I see all these Republican leaders and congressmen and obviously pundits and commentators, and now a lot of Americans say this kind of thing too. But what do you say to someone who says these people have been freeloading on Medicaid, the work requirement argument, which I've said over and over, I don't care who you are, I don't care if you're a terrible person, lazy, asshole, racist, piece of shit person, you deserve health insurance, affordable health insurance and health care. Right. That's how I feel. But what do you say to those who say, you should have to pull your weight, you should have to contribute, you should have skin in the game and work 80 hours a month or whatever the work requirements are to qualify for health insurance? What do you say?
Right. Well, first thing I say is they didn't pass work requirements. They passed work documentation requirements. And so that's the rub. That's how most people will lose insurance on this. It won't be because they're not working or they're not caring for a child or an elderly loved one.
They didn't document their work. Right. Exactly.
It's that they didn't click the right button in the right amount of time on the website, or they didn't have access to internet because rural high-speed internet is still an issue. That's what happened, right? They tried this experiment in Arkansas. 18,000 people from 2018 to 2019 lost their health care. The vast majority, 90-some% of those people were people who, under the guidelines of the requirements, qualified. It was just they got stuck in red tape. So we have a party of supposed smaller government who's introducing a big bureaucracy to take away healthcare from people, and they're doing it under the shield of lazy 29-year-olds playing video games all day.
Right.
It's just not a reality. So, currently 93% of people qualify for Medicaid under their guidelines, but you're going to see a lot of those people who qualify fall off the Medicaid rolls so they can give those tax cuts to billionaires, because again, they just stuck a bunch of red tape in their way of between them and getting
such a great point.
Healthcare.
It's such a great point, because if I did some daycare or some farm work or something, and I did my 10 hours this week or whatever I did, and now I'm waiting for you to sign off on that, but you're not getting back to me. You're busy. You forgot. I'm not a priority. I'm not even, I'm your lowest paid worker. The documentation that I've got to do so I can get to the government so I can qualify, it might not even be up to me. So I worked my ass off at some shit job, and I can't get this guy to sign off on the work that I did, or he shortchanges me for any number of reasons. It's such a racket. It's such bullshit. It's more red tape, and it's the antithesis of what we would think of as streamlining and making government more efficient. And it makes everything harder for everybody. And who wants to be doing paperwork versus taking care of humans? Sorry.
Amen. That's the ad. I think you just did a 30-second ad. We can clip that and just get it out to everyone, and that's it.
Informed by you and the statistics and the data and the experience that you had. Dr. Rob Davidson, thank you so much. Go listen to the podcast. How often are you doing Paging America? Who is this Miles Baker? How do I know I can trust Miles?
You can trust him. Miles is the chief of staff of the Committee to Protect Healthcare. He's got decades of experience. Really cut his teeth in the labor movement, AFL-CIO.
Oh, cool.
Way back, and sort of brings that labor organizing to the Committee to Protect Healthcare. He's the chief of staff there, and then together we get on. He's the politics guy. I'm the healthcare guy, and we kind of go back and forth and examine this kind of intersection of healthcare and politics and building power.
It's awesome. It sounds awesome. I'll have you both on and we'll talk about it, kick it around, because this is an issue that I've been talking about for 15 years. And I know just enough to moderate a conversation, not to give the
Absolutely. Yeah, that'd be great. I'll let them know.
To talk to you guys, keep up the great work. And thanks for joining me here on a Friday as we tape it. Thanks a lot, Rob.
Absolutely. Thanks, Pete.
All right. I'm going to remove Dr. Davidson. If you want to stay, I'll say goodbye. I'm just going to say bye to everybody listening and watching live. Thank you. Go support Dr. Rob Davidson and his work, and the Committee to Protect Healthcare. And there's links to it in the show notes, and go support him. And thank you for supporting me. Can't do it every day without you. This is independent media where I talk to experts and learn a lot and share it with you. Patreon.com/Pete Dominic. I'll talk to you guys later. Bye. Thanks.